like partner to do this capstone project. It's been a pleasure to work with Rebekah Schrier as she completed her capstone project. Rebekah will be earning a dual degree in public policy and social work from the University of Maryland, graduating this month? Yeah. This month, okay. In addition to this rigorous project, Rebekah also served as a legislative fellow for Delegate Pena Melnick, who I think is with us today. Thank you so much for joining.
She's amazing. I would not miss it. I was very blessed to have her. She is a rock star.
Thank you so much. Thank you so much. And that was with the Maryland House Health and Government Operations Committee during this past legislative session. I know Rebekah's put a lot of work into this project, and I know she will have a very bright future as she begins her postgraduate career. So if everybody could please give her a round of applause. I am going to shift my camera so that those of you who are virtual can see Rebekah. Okay.
Awesome.
Okay.
Well, thank you so much, Stephanie, for that introduction, and thank you to Scott for all your guidance and support with this project. I am really excited to present. It has been a long process, so I'm glad that we all made it here, and thank you all for coming to hear about adolescent substance use in Howard County. I conducted a needs assessment and a research review. So my research focused on three main areas. First, the extent of adolescent substance use in the county, also the services that are offered and the gaps in those services, as well as different models that are offered in Maryland and across the country. And I specifically focused on recovery high schools. So for the methodology, I completed the Howard County needs assessment and also a national research review. So for the needs assessment, I interviewed people such as the peer recovery specialist, also the Howard County Public Schools Coordinator for Student Support Services, Cami Wagner, outpatient provider Shannon Garrett of Congruent Counseling, and then Barbara Allen, a local advocate. I also reviewed some documents such as the Youth Risk Behavior Survey and the Howard County Health Department's Youth Opioid Response and Prevention Needs Assessment. And for the National Research Review, I toured some programs, the Phoenix Recovery Academy in Frederick. I also interviewed people from the Phoenix School, which was the first recovery school in the country, and then also toured the Recovery and Academic Program in Montgomery County. And then I also reviewed some research provided by Dr. Andy Finch, who co-founded the Association of Recovery Schools. So for the findings, Howard County Public School high school students reported their current substance use. So in 2018, alcohol was about 22% of students, electronic vapor products about 20%, and marijuana about 13%. In 2021, all of these numbers decreased. So in 2021, about 18% reported using alcohol, about 12% electronic vapor products, and about 10% marijuana. And students were also asked about substances that they had ever used. So in 2018, about 35% had ever used electronic vapor products, about 12% pain medicine, and about 3% cocaine and 2% heroin. In 2021, electronic vapor products decreased to 26%. Pain medicine increased slightly to 13%, and cocaine and heroin remained relatively stable. For the services offered, there are various services for adolescents related to substance use in schools. So there are peer recovery specialists, which I will get into on the next slide. The health centers also conduct craft screenings. So this is an acronym for the 6 questions they ask, such as, have you ever been in a car while intoxicated? There's also community services, such as On Our Own of Howard County, which has peer recovery specialists as well and different advocacy programs. And then 12-step programs, which adolescents can attend, but they're not specifically for adolescents, so it could be hard for them to relate to the whole group. There's also outpatient providers, such as congruent counseling. They have an intensive outpatient program, which is 3 days a week of group therapy for 3 hours. Also individual sessions every other week, and family work and case management. Shepherd Pratt also has support groups and drug education for adolescents. Hilda's Place also diagnoses and treats adolescents for substance use. And then Grassroots Crisis Intervention has screenings for adolescent substance use, but their stabilization services are only for people 18 and older. So not on this slide are residential treatment facilities. So there are not any in Howard County. And then in Maryland as a whole, there's only one, which is in Crownsville, operated by Sandstone Care. So there are services here, but there are also significant gaps for adolescents. And so for the peer recovery specialists, these I'm sure you all know, but they're adults with personal experience with substance use and their own recovery journeys. So 2 peers started working in the Homewood Alternative School in 2021, and a 3rd peer joined in 2022 in one of the comprehensive schools. So I had the pleasure of interviewing Corey, John, and Edward about their work. And they talked a lot about relationship building with students and providing individualized support through one-on-one meetings or group meetings, and also different resources. And they weren't aware of any other states that had done this with peers integrated within the standard schools. So Howard County is leading in that regard. And they do collect data, which those details are in my report. So for recovery schools, these are specifically for students in recovery from substance use disorder. There are currently 42 in 20 states across the US. And later on, I'll be getting into some of the details in 3 of the schools, 1 in Virginia, 1 in Colorado, and 1 in Texas. So Dr. Andy Finch did provide me some research on the recovery school model, and one of the studies found that students in recovery who attended a recovery high school were more likely to graduate and stay sober compared to similar peers who attended their comprehensive school. So there is research on the efficacy of these models. There is one recovery school in Maryland, the Phoenix Recovery Academy in Frederick. The first, as I mentioned, was in Montgomery County, the Phoenix School, so I'll talk about that as well. Now there is a recovery and academic program also in Montgomery County. So for the Phoenix Recovery Academy, I toured and spoke with Heather Whitcomb, the executive director, and Jessica Nicholson, the Academy and Community Relations Director. Here are some photos from the trip of the classrooms and different break rooms and the alternative peer room. So this is a private school. There are currently 5 students and 2 full-time teachers. They have school during the day and then alternative peer groups in the evening. So this is led by a peer recovery specialist and similar to a 12-step program, but specifically for adolescents, and a combination of recovery services and fun activities like the ping pong table in the picture. And yes, it's opened in 2020. I also spoke with Brian Berthium, who founded the Phoenix School in 1979 in Silver Spring, and then Phoenix 2 opened later in Gaithersburg. I also spoke with Mike Bucci, who taught math, and Patty Winters, a local advocate for recovery schools. So this model was through the Montgomery County Public School System. Students were required to be committed to their education and recovery, and to ensure their sobriety, they had to take urinalysis. This model focused on keeping students in recovery with similar students in recovery. So that was a main key to their success. They were isolated from students who use substances. And then what led to its decline was in the early 2000s, the programs were merged with existing alternative programs. So now students in recovery were attending school with students who use substances, which made it more challenging to stay sober. And enrollment declined until in 2013, the program ended. But Patty Winters and other advocates formed the group Phoenix Rising Maryland Recovery School Advocates, and their advocacy led to the Recovery and Academic Program opening in 2018 in Gaithersburg. So this, here's some pictures. These are from the Landing Recovery Clubhouse operated by Shepherd Pratt. I toured and spoke with Khadijah Barkley, the principal. So this is a partnership between MCPS and Shepherd Pratt. Students can either complete school during the day at the Landing, doing an online curriculum called Inventum, or they can attend their comprehensive school and then in the evening attend recovery services at the Landing. There's currently 9 students and 3 MCPS teachers rotate. And they have also a substance use program called SUPRE, that stands for Substance Use Prevention Resiliency Education Program. So here is a chart of the different programs in Maryland, and then also some outside of Maryland. So the Chesterfield Recovery Academy in Virginia, I chose that because of it being close and for its funding model. 5280 in Colorado I chose because of its funding model, and then Archway Academy in Texas I chose because it's the largest school and it's featured in the documentary Generation Found, which provides a lot of great information on the recovery school model. So for academics, the Phoenix Recovery Academy is the only private option out of these 6. And then some of them do have online curriculums that they use, and then Archway Academy as well. The number of students, 5280 is embedded within the charter school, so the recovery program is just one aspect of it. So that may be why it has about 100 students. And then Archway Academy opened in 2003 and has grown to about 100 students now.
Are they embedded in the regular school as well?
No, their program is separate. For recovery services, there are similarities in that the services are individualized, and most of them employ peer recovery specialists and clinicians. Of note, the recovery and academic program does not do any drug testing for students compared to the other programs. But yeah, they have individualized support for the students. And then for funding, the Phoenix Recovery Academy and Archery Academy are the only 2 out of these that have a fee for students. There may be scholarships available, but not necessarily guaranteed. The Phoenix School was from the MCPS budget. RAP started with a grant from the Department of Education, and then also funding comes from the MCPS budget. The Chesterfield Recovery Academy started with a $600,000 state appropriation. So Virginia legislated money to the school board to start this program. And then 5280 in Colorado uses some of the funding from the adult use cannabis market tax revenue. And then there are donations for funding. So here are just a few considerations for Howard County when deciding what programs to expand for adolescents related to substance use. The students served, so would it be specifically for students in recovery? And if so, would they be required to take urinalysis? Accessibility, so a public option is obviously the most accessible for students, or there could be a public-private partnership like RAP, and then a private model is more limited to students who can afford it. The goals of the program, so would it be focusing on prevention, preventing substance use, which the peers can work with students on that within the standard schools, addressing current use, which peers can also work with students, or would it be focusing on recovery, so just for students who are actively in recovery from substance use. The staff, so for recovery staffing, it could be peer recovery specialists, licensed clinicians, or other mental health providers, or a combination. Also the teachers and the administrators are important to think about where they are coming from. The cost, so Howard County Public Schools currently spends about $17,000 per student per year, and on average, recovery high schools are about $25,000 per student per year. But Andy Finch mentioned that this model is more economical to residential treatment, especially if students are going to treatment, coming out, and then if they relapse, going back. So that multiple times could be pretty costly. And then funding, Howard County's Opioid Collaborative Community Council is currently working on recommendations for the opioid abatement fund. So recovery services could be a part of that. Also cannabis tax revenue, that would have to be legislated through the state. Funding could come from the Howard County Public Schools budget or a state appropriation like Virginia did. And there could also be opportunities for grants or donations. And then the location, would it be in its own building, which could be costly unless the building is donated. But then students are separated from students who use substances, or within an existing school that could lower the cost. But as we saw with the Phoenix School in Montgomery County, when students were merged with students using substances, then it led to the program's decline. And then also family involvement, if it is required or not, and how the family is being involved. So that is all. Thank you all so much for listening. Any questions?
Let me just repeat Juan's, just so everybody can hear. Juan here was asking if Rebekah was able to identify like any programs or resources to help young people and their families where they are Spanish speaking. Right?
Yeah.
Okay.
Specifically talking to people that provide services in Spanish, but there may be some out there. And that's definitely a need. So
Yeah.
yeah, that is part of the gap too. Yeah, I appreciate you pointing that out. Shannon.
Can I, Second Chance in Rockville is a Spanish speaking IOP. They could use on it. So that's a possibility to reach out to them. as well.
You know, adolescent or just adult?
I don't know. It's a good question.
Areas.
So Rebekah, what would you like to see? Makes the most sense to you.
That's a good question. I mean, personally, I think it is a good idea to bring everyone to the table before making that decision. So I know accessibility is a bit goal for Howard County and making sure that any program is available to any student who needs it. So I think having like some kind of work group could be good, bringing in different stakeholders, like the public schools and also the health department and peers and different providers in the community. So yeah, I think that could be a good first step after this, to talk about what's feasible and then how to address the needs for students.
I have one from the chat. Liza Guroff asked, will we be able to get presentation with data results?
Yeah, I can also share this, and then my report is still being finalized, but I will send that to the Howard County Health Department. And then I'm fine with it being out to anyone, so I would send it to anyone who's interested.
I just, since we met, you were at the meeting with Cammy that started it.
Yeah.
We've got, I think, I know I'm in 2 high schools, but I think we've got 4 now that we've actually inserted missions for groups. So like at Homewood Center now, we've got 15 people on the list, but because of I did it on Friday, then we have people they get in trouble and they get suspended. So that's a little difficult to get them all in the group at the same time. But then Ed and I and we've been working also Wednesday night at Wild Lake every day morning, and that's actually totally coming together really well. There's a lot of good cohesion there. So I'm looking forward next year to be able to give them some data on what we found is useful and that up more schools next year when they find that it's a good place to spend their county money. So that's exciting.
Yeah.
It's been a long time waiting, a lot of fight to get in there. And some group of it. It's not someone from just.
So one of the things I was thinking of is the recovery schools that are funded, through the state, or there was one there that was funded through marijuana. And as you know, on July 1st, becomes recreational use, to be taxed, I guess, and have more money in Maryland for something like that. Do you think it's gonna impact like recovery schools coming up?
Yeah, so I did take a look at the legislation that passed related to cannabis legalization, and right now, the funding, there is a fund for community reinvestment, but it's specifically for communities most disproportionately impacted by criminalization. So it didn't say anything about recovery services specifically, but that could be an option, like next year during the legislative session, someone could introduce a bill that puts some of that funding to recovery services. But at least, yeah, right now, I don't think that is part of the legislation.
How do we support that? Like, what do you, now that you
Right.
you learned from delegates and all these wonderful people, what do Aaron and I do? Do we go down with signs? How do we support something like that?
Yeah, I think organizing people who support that and then approaching different legislators to see if they would be willing to sponsor a bill that would direct some of that funding to recovery services. I think that's a good step. And yeah, now I do have obviously connections with Delegate Pena Melnick and different people in the General Assembly. So I think, yeah, that's a good step.
You ready, Aaron?
I need more money. No.
So a couple from the chat, they did request that you repeat the questions from the audience.
Okay.
audibly. And Mary Lacoste asks, with all your research, what would you recommend to those doing this work as a starting off point? What would our biggest obstacle be and how could we overcome it?
Yeah, that's a good question. I think one of the biggest obstacles is funding probably. So there is like interviewing everyone and talking with people. There is a lot of passion and commitment for the work. But it is like, where exactly does that funding come from? So like for the Phoenix Recovery Academy, donations and different foundations have supported them. But getting a more reliable and consistent funding source would probably help their program. So I think funding is probably a big barrier. Was there another part of that question?
I think just what was the biggest obstacle and how to overcome it.
Oh, okay.
And the starting off point.
Mhm.
So,
Yeah, so I think, yeah, coming together, like I mentioned, like having some sort of work group to talk about those things and pooling resources from different areas could be beneficial.
thank you.
Were you shocked by the YRBS data?
Yeah, honestly,
I
I'm-
was.
yeah,
I've seen it too.
I was kind of expecting,
Can you pull that back up? Because I know I heard somebody over here sigh also that pre-pandemic, our substance numbers were worse than after, which I don't see that when I walk into the bathroom of school and I get like vape blown in my face. I don't- Not purposely.
And I was curious in the collection process of this, was there like any pushback? Was it open participation and?
yeah, everyone was super willing to share about their experiences and work. So yeah, I didn't get any pushback, and that's hopeful and inspiring to, yeah, keep the momentum going.
They take lie detector tests.
Yeah, for this, I don't know.
Yeah, that's that.
Based on the percentage of students that you, surveyed there, it's like 25% of 100. You just like looking and searching for people. Voluntary identifiers, people who use substances.
It's not her, it's Steve.
Yeah.
Steve collects the data. You can go and look. It's really good data. You can look by state, by county, by age, by grade, by substance, by risk of suicide. I highly recommend you take a look. I'd be willing to come and do a training on it.
Thinking, I heard you mention disproportionate areas that will receive the funding. Or the school, whatever. Was there a disproportionate area in Howard County?
I don't know that specifically. So you're talking about the cannabis
Right.
fund? Yeah, I don't know. Yeah.
One thing that I haven't heard mentioned, the way Phoenix One started was school board members.
Mhm.
And I don't hear that as being discussed as an avenue that might lead to a program.
Right.
But the way the Phoenix One program came about was some school board members approached me. I was working in the private sector. And they had kids that they were kicking out of the schools for selling drugs and using drugs. And they said that they wanted to start a school for those kids and would like to go over and do that. So I did. But I don't see that model being expanded at all. I don't see anybody approaching school board members to see whether or not they'd be receptive in doing something.
That's
Yeah.
actually how RAP came about, because I have as well as others. But yeah, that would be a good route as well. Yeah. Teamwork, yeah.
Is Candy on that board? Wagner's?
All it takes is one school board member to be really motivated to do that,
Yeah.
to spill over to the other.
Yes.
To be
So
specifically. put out.
Rebecca, this was all phenomenal, extensive research. And I was wondering, did anything surprise you as you were digging into all that?
Yeah, I was surprised about some of the lack of services, specifically for adolescents. So just the one residential treatment facility. But talking with Shannon and explaining how like 20 years ago, there were a lot more services, and then the funding started dropping for that. And part of it, I think you mentioned, was like decriminalization of cannabis and.
That's my opinion.
Right.
Courts stopped,
Yeah.
they stopped sending adolescents to treatment.
Right.
And for marijuana charges, and no 15 or 16-year-old says, Mom, I really think I'm smoking too much weed, I need to go inpatient. So, we saw our 53 bed facility slowly go down to 12. As the others started closing, we started getting their clients, but it was just a matter of time. And every single one of them, medical assistance wise in the state of Maryland, was shut down. And that is, we get calls. Where do I send this 16-year-old who's addicted to opiates for treatment? And it's like the hospital. I don't have an option there. And that to me is criminal. It's all apparent. Sorry.
A peer from Delaware reached out to me yesterday. 18 and 16, they're twins. Oh.
15 and 16 and they're 12.
Whatever kind of twins that don't look alike,
They were born 2 years later, the same way.
twins and name only.
Good job, Greg.
We have some comments in the chat.
No, you can't.
Andrew Finch, he said, with legislation, I suggest specifying allowing to fund youth programs in recovery. Many people think youth and recovery are not linked. Some think only prevention dollars should go to youth, but Recovery High School provide recovery services for youth. Brian Berthium will have some great ideas about lessons learned. Recommend not trying to be everything for everybody. A school is different from a treatment center.
Yeah.
And I don't know if Andrew could share it, but I know there's a conference coming up in the summer. Would somebody mind sharing that if you have that information on the recovery school conference?
Yes, it's in Columbus, Ohio.
Columbus, Ohio.
Road trip.
Yeah,
Shotgun.
I have a really big van. You gotta go.
Kind of it from the chat.
Okay.
So Rebecca, so just to tag on what Andy was saying, and the person who asked earlier, what are some obstacles and how to overcome? I see reps still running into this when I talk to the staff, that too many people still don't understand the difference between treatment and a recovery school. And so the staff was saying, they have to refer a lot of families for their child because they come thinking that their child can get treatment there. And then the other problem you mentioned, there's just such a capacity in this state of treatment for kids. It is criminal, like you said.
I believe that people have to understand that there's steps and phases to this, starting with the individual who suffers from addiction. Then, as I said, in order to get treatment, whatever particular substance they may be using, yes, they have that level of care.
Yeah.
But the recovery school idea is still valid, because once they come from there, where do they go? What do they fill that void with?
And to prevent the relapse.
Exactly.
Yeah.
And people with lived experience, right there, just like them, showing them what they did in order to stay sober and clean.
Yes.
One thing I left out about the Phoenix one, if it hadn't been for the kids at the Phoenix school going to AA and NA, the first 2 years that I ran the school, everybody was still getting high after school, but not as much. And somewhere along the line, I became aware of the AA, NA community. Kids started going there, and one thing led to another. Before I knew it, I decided to make that a prerequisite. In order to be in the school, the kids had to go to meetings, get a sponsor, and all that. As soon as that happened, it was a dramatic improvement in outcomes.
And what happened back then in Montgomery County is the young people regions were created, and it suddenly had a young people community in the meetings, and the older people were moving rooms. Like, cause there was 20 of us, 20 people in the meeting, and the older people were like, talking about your girlfriend and your mom and dad. So they got a different room in the church, and the next thing you knew, you had 20 people, 40 people, 50 people that were, coming to meetings, and that, but they need to come from somewhere, right? And was beautiful that they had an opportunity to come from that school to the meeting and get that support. Phoenix is doing it a little bit in Phoenix Academy with their own kind of virtual group. So they've got some Sandstone young people coming. I'm trying to send some links of young people but it's virtual. So it's like they need, that's developmental for adolescents, no offense. They don't want to hang out with us, right? They need to hang out with each other, and that's where they need to find that safe social group. And in school, it's just not there. Sorry, I get excited.
You find a school in a location, there's some.
The court's involved in this in any way? Or is like sanctioning them there? No, as a deterrent.
It's,
Rather than get about it, get kicked out of school, they had that type of resource for those years, and they were held accountable and responsible at that level, their peers, and the people inside the recovery school, then they probably, be more apt to try to get right back on track. And, we would have so many kids being suspended from school, staying at home, still partying in the hanging out in the street, partying, They should be in school, training or something.
We've heard a lot about the, in Shepherd Pratt, you mentioned it, the clubhouse model, but I don't hear a lot about them. There was a huge, like Baltimore City built one, Frederick built one, Montgomery County built one, and yet I don't know that the kids went the whole lot. I could be wrong. Don't, like, if you're familiar with clubhouses, if you're online,
Speak up.
please share about that. But there was a lot of funding 10 years ago, 5 years ago for that, and it was a great opportunity to try to get kids together, but that didn't mean they were gonna be in recovery. It just meant it was a safe place for them to go, potentially use.
I remember going to meetings when I was young, being forced to go. And like, fast forward, it would like gave me, like, okay, I know where to go. And I actually like was ready to like do the thing. In terms of like schools there, I think it would be helpful to have some after-school program.
Yeah, that's like Phoenix says, I feel like I'm selling them, but they have that APG program, and it is an after-school program. They take them places, right? They go hiking and they go do things in the community together, but there's only 5 of them or 8 of them. What do you?
Right, and those kids paid for it. Phoenix Academies.
There's some funding too. There's so few. They did a lot of great fundraising, right? I mean, they get a
Yeah.
portion of my check every month. Right?
But that versus Howard County schools. We have 8 in the Phoenix Academy. We have 12 for every one. Sure. So it's like, if there was some sort of like clubhousey type thing where they can go, where these kids aren't necessarily like healthy or whatever the word would be. You know, parents can't exactly afford, you know, the after-school programs or a place like the Phoenix Academy. Because I remember growing up in Howard County, that was like, there was nothing else to do but get high. You know, when it was finally time for me to get it together, I didn't have any other choice. That wasn't until I was 27, 28 years old.
I have a question about that you can't answer, but more
How do you know?
present. In the effect that I know Gateway has been in existence before it was Homewood, that alternative education was implemented to deal with the student population that couldn't be dealt with in other ways in the comprehensive school system. But even the staff at Homewood says that they cannot address the substance use issue because they're still just dealing with the behavioral and, you know, like the mental health aspects and the behavioral aspects that got those kids put in that school, in which case, how many students does it take for the general population and the Department of Education of Howard County to determine funding necessary to develop a program for the kids that overdose, for the kids that get busted with a locker full of drugs or selling drugs? You know, and obviously, like, there's always the concern of mixing those kids because then they network in that same network. But I mean, they're already doing that in the schools that they're in which case, in the last 5 years, the number of students getting found with opioids, having overdose, whether in school or at home, has drastically increased, and not just because of fentanyl, but because of the increased social exposure to it. In which case, if they look at it now and develop a program now, I feel like that would be a preemptive solution or plan rather than waiting until it is an actual crisis. Because
That's gonna be part of your problem. Because, no offense to the delegates online, they're gonna go to data,
well, that's
and they're gonna see
Go to the
something's
next slide.
working.
Go to the next
Well,
slide.
it's 21.
But the next slide, they still showed increase, which is the people that are actually even honestly reporting. And this is only out of 1,000 students, which, you know, is like, that's not even one school
Right.
in Howard
Yeah.
County. So,
And even
I don't
though
know.
it's small, cocaine and.
I mean, if you look at the number of kids who are openly honest just at Homewood,
Yeah, yeah.
those numbers would be
Right.
Right.
above 50%, you know, for at least tried it, you know, like they might not do it regularly, they might not be cocaine addicts, but I guarantee a ton of them have tried cocaine, and LSD wasn't even on that list, which like, that number's gotta be off the charts.
That was my thing too, when I saw that, even if it's CDC or not, you know, I know they're a big organization and they cover a lot of stuff and, you know, and people respect their, you know, their data and their information, but when you talk about reality and honesty and truthfulness, you know, that's a whole different ballgame. Right? You get statistics based on what people want to share. And if you get
Well,
honest,
they're aware of that. I mean, they know when they
I'm
get.
sure they don't take into
Um,
consideration.
Barbara has her hand up. We're just gonna,
Barbara, hi Barbara.
Barbara,
Hey Barbara.
please share. Unmute yourself, share.
I'm trying.
I could hear you.
She want to speak?
I think so.
Trying to listen to me.
Is it okay, Barbara?
Yourself again. Yeah.
Oh,
Don't hear you.
Can you hear me?
okay, now we can.
Yes.
Okay, my system's running a little slow to say the least. So a couple of comments. A couple years back at an event, a youth event in Howard County, a 17-year-old gal came up to me and said, I spent 9 months in treatment and then I went back to school here in Howard County and people are handing me drugs in the hallway. And to me, that's just a reality of something for us to keep in mind. And you all were talking about it. But I also want to comment about the clubhouses. For several years, Dr. Maria Radowski-Stanko, who's head of the children's programs for Behavioral Health Administration, she put forth that clubhouses were the answer. And our pushback was nothing against clubhouses and after-school programs, but they are not the answer for treatment. They are activities and they offer a really great number of things to do. And many jurisdictions across the state, 5 or 6 that I can think of, did get grant funding through OCC grants and do provide after-school programs for teens, some just teens in general and teens at risk. So make that, there are options out there for us to take a look at. And in that case, because the state has already paid for some of those the programs themselves, we can we can get access to them without having to repurchase, if you will, a program. Last comment that I'll make is that when it comes to funding, I just want to be sure everybody is really clear that when it comes to youth, we are not only looking at prevention. We know there are students using. We're looking at intervention, treatment, and recovery across the whole spectrum. So believe me, many of you, I know many of you, I love you dearly. Those I don't know, I'm glad to meet you. But at every level, we're talking about the whole spectrum of need for programs, whether you're 10 years old and falling into this world or you're at the age of 80. And we do not exclude the youth in any way, shape, or form. If I was to pick some of the top 4 topics that we're working on statewide, it is youth, absolutely. So it's not a rarity. We have the Children's Behavioral Health Coalition as an example that focuses specifically on this, and people right here at Howard County are very involved, including Maryland Coalition of Families. So that's I'll stop there because y'all are doing a great job of bringing these topics up. And I thank Rebekah for her research as well to help us all, make better decisions, especially when it comes to resourcing and funding. So thanks to all. And now I'll figure out how to unmute myself again.
Barbara, I just wanted to give you credit because I know it was in one of our work groups where we were talking about the needs of adolescents. And you mentioned, having a recovery high school. And it just, it reminded me of, what a great option that is for young people. And I just thought, this would definitely be a good area for growth. So thank you for the idea. Would anybody else who's virtual, would you like to unmute or kind of share any thoughts that you have? I'm sorry it's so hard to kind of go back and forth and for the sound. But anybody who's joining us virtually, if you would like to just, make any comments.
Hi, this is Andy Finch. I've been kind of typing a lot in the chat, but
Yeah.
really enjoyed the presentation a lot. And I think what I really like about it is the diversity of schools that you represented. I think that's one thing about recovery high schools that everybody has to realize is there's just so many different types of programs out there, and they tend to mold to fit the community that is opening it. And so I think as you all are talking about this, I think that's a good news thing. There isn't just a one size fits all. But one thing I put in the chat is, it also doesn't mean that one school should do everything. So whatever you decide to do, and hopefully you build on this data, that those kids who actually need recovery support, a program for them might end up being small, but it's going to have a huge ripple effect. And I think there's a lot of lessons to be learned from schools in the past. But anyway, I hope to help you along this journey however I can. But I really was excited to hear the presentation. Well done.
Anyone like medication assist oxygen? Yeah, Vivek.
That's a good question. I'm not sure. Oh,
I don't think it's better.
okay. Yeah.
Maybe after some.
You just speak up a little bit.
Hey, something struck me as John was talking. I participate with this other organization. We always say nothing for us without us. And when I hear you speak, when I hear John speak in past tense of like there being nothing else to do in school but get high or use drugs and alcohol, how it took them from high school day to the age of, I think you said 27, to find some other ways to get abstinent from drugs or to get into recovery, right? I think someone like that should be a part of the conversation coming up with these things, because I think I know when we went into Homewood, when we first started taking the peers into the school, we all introduced ourselves and they were happy to have us there. John introduced himself as an alumni of that school, where he was at today, that they tend to listen a little, right? Because it could be someone who's delegates or the board or whoever's giving these funds up, whose child is at the age that John was when he was in the, might make a little bit, open that purse.
You reminding me of something I left out. Success of that school. Way the school board members, getting them to go for the idea of a recovery high school is not, it's not as easy, it's not easy. And the way that I did it, I would bring along with me a kid that had gotten sober and turned his life around and have him talk to the school board member, and that's what got their support.
Every time.
Absolutely.
I like John. I mean, no, because you do present, you know, a hard.
We
story.
can't hear.
You can't hear.
No, it just sounds like mumbles. We can't hear what people are saying. I don't know if they can speak
So,
up or whether can be moved closer
yeah.
to them.
And some of the points that they were making, just how important it is kind of like going to the Board of Ed members. And then also the value in having like young people who are in recovery, kind of sharing their personal experiences with people as you're trying to advocate. And so we're kind of saying that's really important. And like Jack was kind of saying, like, you know, any advocacy that you're trying to do, you need to include people who are in recovery and people with lived experience and, you know, making sure to take everybody's perspective, you know, into consideration.
Howard County developing their own data?
Yeah, we spoke with Cami. I think she said the school system is doing a needs assessment on adolescent substance use. So speaking directly with students and having focus groups and surveys. So I don't know progress on that, but that's something to keep an eye on.
And
Should be on.
yeah. Tammy, are you there?
He's like, oh no.
I'm sorry, because it's hard
Me,
to.
Cammy?
Cammy,
Yeah, I'm here.
hi. They were just, I think Shannon was asking if, Shannon
Hey,
was
friends.
asking if the school system is collecting their own data.
Or the county, just Howard County,
On what, Shannon?
substance use in Howard County.
I mean, as much data as we can get. We are conducting some focus groups and a data review and literature review with a consulting firm. But the data is hard to get. That's the problem.
Just going back to the question about MAT or MOUD in school. It is being used with some students in other schools, but not, you know, Maryland specific. And Montgomery Goes Purple is providing education on MOUD parents. We work closely with MCPS, who will be releasing a new policy to permit students to carry/use Narcan MOUD are our next.
Who was sharing that?
Laura Mitchell.
Okay.
Yeah, so MCPS will be releasing that policy this week. It's been completed, it's signed for the Narcan. And we've been doing the family forums on fentanyl, providing training and giving Narcan to families and youth as young as 14. You can also go into any fire station in Montgomery County and get Narcan. So we're really trying to make sure that's there. At the same time, backing upstream to the prevention, intervention, and treatment. So the most critical, because we've had so many overdoses, was getting Narcan in people's hands and having them be able to carry it. Had an incident last month, I think it was last month, that students left for lunch, went to the McDonald's down the street, one overdosed in the bathroom, another one had Narcan because of these activities that we've been doing, and saved them while they waited for EMS because they've been in there for a while. So those kinds of things are the reasons that we're doing it. I do know that RICA took their first student on MOUD. So that's another state level to look at. It's coordinated, of course, with the schools and the state level, but their residential education facility, the regional, I can't even remember what it stands for, but they have their first student that's just as involved on MOUD at the Montgomery County facility. Hopefully that goes well and we will be able to utilize that more as it's needed. But I'm a little unclear about, are you thinking about schools being the provider, having the providers in the school to do the induction and treatment, or just having students in school who are being treated?
Treatment. What are we talking about here?
Level of care.
Do you want me to answer that one?
Yeah, I can't hear, so please.
I can't hear if anybody in the room is talking.
I think they were just trying to clarify the question.
No, not in school. That's a lot.
I don't think you're looking at separate.
Okay, they're saying no, not looking at the schools too.
They won't even let us talk about Narcan. But I'm fairly certain they don't want us talking about. It's cool.
Yeah, we've trained all our bus drivers and our security staff, in addition to the Maryland state law required admins and having it in the schools, double stocked the schools. And I mean, it's made a difference. We've had 13 administrations of Narcan just this school year.
Did you say double stock the school?
Yeah, so they were previously only keeping 2 sets of doses, so 4 doses of Narcan. Now they're keeping 8 in every school. We're having conversations about putting them, co-locating them with AEDs in our schools. So because some of them are huge. So getting additional doses if you have multiple overdoses at once or something really, really strong. And we're preparing to put out a notice. We did the fentanyl notice in December, our school health officer. I gotta tell you, that was key in getting this conversation going in school, having them hire a health officer, the medical doctor in the school system. But we're preparing to do another one around xylazine as well. Maybe if someone could repeat what's being said, someone that's closer to the mic.
I think everybody's very impressed that that's what's happening for Montgomery County.
Yeah, we have 1 unit per nurse per school.
Can you hear him? We have 1 unit of Narcan per nurse per school.
And the nurse does 1 training per year, per school.
They're required to have nurse and backup. So they're required by state law to have admins trained or additional people trained.
So admins are trained and teachers?
Yes. Well, anybody can get trained and carry it by state law. It's covered under the Good Samaritan and in the open order. So they can't tell them they can't carry it. There may be some hesitation around administering it, but they are protected by law, by Maryland law, to do that. So from a teachers union or other messaging, that might happen. I think the key really for us was getting the conversation started so the parents were asking questions and saying, what are you doing? What's going on? What are we doing about it? How are you helping? If you're not helping, you're hurting. And that pressure coming from the parents and from the students have been really amazing about this. That got the school system moving.
Question for you. We talk a lot about like the barriers, but what do you, in your research, what would the most hopeful thing was for Howard County?
Nice.
Yeah.
Positive.
I think definitely the enthusiasm with inspiring, and that you 3, the peers, are in now, with the potential to speak with more students and continue to grow that program. I think that's definitely a great starting point. Yeah, I think that's.
Yeah, so working through your student governments, you can also get student involvement in this. I know for our school board, when the students speak, they listen much more than when the parents speak. Involving your PTAs, you have a council of PTAs. So there's a county level council. The state's on board with state PTAs on board with it, national PTAs on board with it. So you have a lot of backup around that.
I'm sorry, I see Mike, you also have your hand raised. I'm sorry if you've had your hand raised a long time. I know your arm's getting tired. Would you like to share, Mike?
Sure. First of all, I applaud all of you here. I worked with Brian at the Phoenix School in Montgomery County for 20 years, and you know, we talked frequently about being in the business of saving lives. During that 20 years, we attended a lot of funerals, But also, I just wanted to share, there's data and there's anecdotes, and this past weekend, I spent a weekend at a music festival with three kids who in the 1980s were at the Phoenix School and have maintained sobriety through that time period. Last week, I had lunch with a Phoenix student from the 80s who is now part of the after-school program up at the Frederick Phoenix Academy there. So keep up the good work.
Thank you, Mike.
So they are having successes with after-school programming, long-term. I want to flip the table over. That
Can't hear.
everything I've heard from other people in other counties and other states, I've suggested in this county, and people, well, we either don't have the money, which can't be helped, or it's just not a good idea. It's not going to work, not for our kids, not here, not in this county.
Can you hear John?
I can't hear it.
John's just saying how frustrating it is because he feels like he's made a lot of suggestions, but so far these things haven't happened in Howard County.
So if
Yeah.
I may, another thing that we've done here is in Montgomery County, I chair the county's Alcohol and Other Drug Addiction Advisory Council. Notice I said addiction, not abuse. We changed our name. We changed the charter, and we're working on the county code. All the revisions have been submitted to change all of the language in our county code to not be stigmatizing. We don't use words like abuse. We don't use addict. We use person first, non-stigmatizing language and medically appropriate, because when you start talking about it that way, people view it as medical and not a choice, not a moral failing, all of those things that we grew up believing. And the conversations are harder to ignore and much more open-minded, I've found. So I'm putting some resources in the chat, but I'm happy to email them too if you need.
Thank you so much. Andy, have you published your book yet?
I am, by the end of the year, my hope. I'm editing it right now, but it's 650 pages, so it's going slow. But I will tell you, when it comes out, Maryland is featured prominently. So I would be excited to see Maryland back where it used to be for about 30 years. But thank you for asking.
Thank you. So some summer reading, did you say? Okay, well, please let us know when it's available. I'm sure a lot of us would like to read it or listen to it on audio.
Definitely.
On a long car trip. Okay. Anybody else who's virtual that would like to share any thoughts? Or Mike, do you still have your hand up? Would you like to share again, or I don't know. Okay. Anything else in the chat that?
Andrew Finch made a comment that all schools should have Narcan on hand, but keep in mind that nationally, cannabis and alcohol are still the top substances requiring treatment for those aged 12 to 17, and kids in recovery high schools tend to use multiple substances.
Corey is just reading us what's in the chat.
Also, at the Howard County Health Department, we do outreach to all groups, including parents and students. We recently had an event on opioid with Howard County Public School parents where we provided Narcan training to over 30 parents. And Barbara said, heads up, there will be a series of town hall events in all jurisdictions beginning in June. This is the Maryland Opioid Operational Command Center, including the Maryland Opioid Restitution Fund Advisory Council. Youth-related issues. This would be a great opportunity to put all thoughts out there.
How will that be promoted? Okay.
Corey read to us, Barbara, the announcement you were sharing, and Patty was asking, how will it be promoted? How will we know for those town halls? Okay.
And hear me.
Yeah,
They've been
now we can,
sending out emails and it's on their website.
Well,
okay, on the,
they have 6 sites or 6 dates agreed to now, and they're working on getting those laid out so there can be great promotion. I can guarantee you that I will be getting that information. I'll send it out through the OCCC. We'll send it out to every distribution list or person that can follow or send it out. And of course, it will be, as Laura says, it's going to be on their the OCC's website if you follow that at all before it's too late. Is how you find that. But they're finalizing the dates literally right now. I would have preferred to have it 3 weeks ago, but getting people like, there's this little guy named the governor to be available for some of them. So just stay tuned. We'll get it out to you probably within the next 4 to 6 weeks at the latest.
thank you, Barbara.
And I am happy to meet with or talk with anybody who wants to strategize or come up with ideas about involving, how to get the schools involved, how to get families involved, what we did. I mean, I don't have all the answers, but I'm happy to share how we did it.
Thank you, Laura. Okay, well, I think we're coming to a close. I know many of us care a lot about this topic and like the movement in this area. So can you hear me okay? Okay. So, I mean, I really appreciated Rebekah's suggestion of like having a work group where people who want to be involved can continue to come together to kind of develop ideas, and working with the University of Maryland and the graduate students in the School of Public Policy and Social Work, continuing to research and develop. I know that through the Association of Recovery Schools, they did join in the Maryland marketplace. And so they are able to work with us to provide more consultation and trainings as well. Yeah, because they're based out of Ohio, I believe, but can help us too. So any final thoughts, anybody? Patty was asking how Rebekah chose to focus on this topic.
Yeah, so, well, through my internship with Delegate Pena Melnick, I was doing a lot of health policy research, and looking at preventing overdoses and things. So then when the Capstone class, we got all the proposals for projects, and I saw Howard County Health Departments, and I thought it was really great to be aligned with my internship as well. So it was my #1 choice, and thankfully I got it, so.
Well done.
Thank you.
So I think this is the conclusion of the presentation, but I think Rebekah should continue to join with the efforts, and hopefully we can all continue to work together to help make progress. So thank you, everybody. Thank you, everyone who joined virtually. I apologize for the sound and that the room doesn't really pick up the comments and questions that are in the room, but thank you for bearing with us. And everybody in the room, thank you for coming. Rebekah, thank you, and her Professor Call, thank you for coming.
Thank you so much.
Thank you. Okay. Send us more students.
I'll definitely reach out over the summer.
Okay. Okay, good. All right.
Congrats.
Thank you, everybody. Thank you so much for joining. Thank you. Have a nice rest of your day. Okay, bye.
Thank you.
Bye.